welcome to the November LINEA webinar. Today we'll be having a presentation from Stellit, which is a Russian NGO. They'll be presenting their research on the entrance and immersion of young people into selling sex in Russia, with a focus on the role that social norms play. So as many of you know, LINEA is the learning initiative on norms, exploitation, and abuse. This project is based at the Gender Violence and Health Center at the London School of Hygiene and Tropical Medicine, and the LINEA network includes members from around the world. Our aim is to foster the use of the social norms approach in preventing the sexual exploitation of children and adolescents. So we organize regular webinars, about an hour long, covering different aspects of social norms and structural drivers related to the sexual exploitation and abuse of young people. So I'm pleased to introduce today's presenters, Dr. MAIA RUSAKOVA and Veronika Odonokova. MAIA is an associate professor at Saint-Petersburg State University in Russia, and she's also the founder and the director of the NGO Stellit. Veronika is a social psychologist, and she's been working with Stellit for more than 10 years, and she's currently serving as the head of the innovations department. Stellit has a strong commitment to both research and direct work with young people in Russia. So if anyone is interested to know more about the organization, we welcome you to ask about that as well during the questions and answer session. I'm sure they'd be happy to share some more information about their work. So today, MAIA and Veronika will be presenting findings from their research with a diverse group of female sex workers in 2 Russian cities, focusing on those who began selling sex under the age of 18. And then we'll have quite a bit of time for questions and answers at the end. So with that, I'll hand things over to our presenters.
Thank you, Rebecca. Good morning. Not good morning. I think that it's an evening right now, or middle of the day. So I'm really glad that you joined our webinar. So me and my colleague Veronika will be happy to share with you some results which we collected. From the very beginning, I just want to say that all these years we were wearing a different hats, I can say, at the same moment, which from the one point of view make it a little bit complicated because we are working both in the universities and in non-governmental organizations. And so we work in the academical research and also in the practical field. And from the middle, let's say 10 years ago, we also start to be more involved in the international work, and also now I'm serving as the ECPAT board member and the representative of Eastern Europe and Central Asia. All of it gave us some possibilities to mix a little bit the field of academical research and the practical field, and also use some international perspective, like some international approach. So we will start with the background and just to give you some information that, of course, prostitution is a violation of the administrative code in Russia. The organizing of the sex business involving adults or children is also a violation of the criminal code. Sex with someone below 16 is a violation of the criminal code. What we also need to say that there is no population-based surveys focused on the sex attitudes, generally speaking. So we don't know which behavior actually people demonstrate and have between the Russian population, including the young people. And I can say that this gap is more than 10 years right now. So we do not have the information about the general population, and it's very, very pity because it's very hard to compare the data, for example, from any kinds of risk groups or the specific groups with the general population in Russia. I can say in the last 5 years we have a ban on any kind of sexual education at school, so we actually not allowed to speak with the minors about the sex and even in the prevention way. And this is a very hard, I can say, discussion right now in our society and between the professionals about the results of this policy. Also, in Russia, we do not have any kind of national plan which will be focused on the commercial sexual exploitation of children. Also, to give you some general population attitudes, as you can see on the slide. Like in the last 25 years in Russia, we have a very big changes. Of course, you're familiar with this. After the collapse of the Soviet Union, we had a big change in the, I can say, all areas of the life of the people. And the values, norms, attitudes were changed completely. Another thing is that we have some data which is based on the study which was made in the National Representative Survey. You can see the link. So if you will be interested, you can also go to this link and know more about it. So there's some attitudes to prostitution among the general population in Russia. So as you can see, like only 15% of males and 5% of the females think that it's acceptable. 12 and 10% like think that it's sometimes acceptable, and for 73% and 83%, this is not unacceptable. This is absolutely unacceptable. I can say that I trust this data. I can say, generally speaking, because of course it will be a big difference if you will look to the cities like St. Petersburg and Moscow, for example. But unfortunately or luckily, this is not Russia, generally speaking. So this is the two big megapolises. And we know more about what the people think, like in these two cities, than what we know about the people in the rural areas, in the small towns and cities. So this national, survey actually represent of the sorts of the general population, I can say, in Russia. Here you can see some attitudes to selling sex among the adolescents. We were involved in this research, so from the very beginning. So we actually conduct this data in the northwest Russia, and I can say that, of course, the situation was changed because this data was collected, let's say, 10 years ago. But it was focused on mostly on the risk groups of the minors, and it can show that even, for example, 10 years ago, between the adolescents, the attitudes towards having sexual intercourse for pay was quite high. So, and we can say that between risk groups, this situation didn't change a lot. So this is our hypothesis, I can say. So if we will move to our work in the field of prostitution, of course, we somehow follow the money, and that is why we will have some problems even with the different definitions and terms which we will use even during this presentation. Because, for example, we were involved in the big research which was funded by FHI, Family Health International, and it's totally based on the all definitions which are used in the public health. And in public health, we use sex work and the sex workers. And all research which were done in Russia and which were funded by any kinds of the HIV money, let's put it like this, we'll use this terminology and we will use these definitions. Also, because we are part of the Russian sociology, so our tradition is based on the deviance and social control theories. And that means that we use the terms like deviant behavior, like deviance, like not normal behavior, and so on. So, of course, there are more questions than the answers about what is deviant. I think sometimes it's much more easier to say what is deviant than to say what is normal. But I can say that in our, even between our decision makers and the authorities, they quite often use the terminology and definitions which came from the tradition of the sociology of deviant behavior. And also, it's based on our work with the street and indoor prostitution in St. Petersburg, which we conducted in Stellit during the 5 years. So when we had our own outreach and we work with the women, and we even discuss with them what is the terms and what are the definitions which they want us to use. And surprisingly for us, they were much more in favor of using the word of prostitution, even it is a stigma and somehow negative terminology. Our research on the women in prostitution started in 90s. So, and we made several big studies in St. Petersburg and in several big cities in Russian Federation during the several years. But our move to commercial sexual exploitation of children actually happened by accident. We never planned it. We did it because we were curious. And honestly speaking, I just read the article about the Thailand and about the children in prostitution in Thailand and sex tourism, and I just got an idea that we probably should have something like this in Russia. And I didn't know at that moment that it will move us actually to the field of commercial sexual exploitation of children, and that we will work a lot in the prevention, and we will start, I can say, the movement like in Russia against the commercial sexual exploitation of children. So, but it started with a couple of researching and which we made, like for example about the sex tourism, and in 2002 we also were involved in creating the trainings for professionals, and we had also outreach for children who were involved in prostitution in St. Petersburg. So we start to work, but of course it was a completely different approach, I can say, for us. And for many years in Stellit, we even had the different departments, those who were focused on adults in prostitution and those who were focused on the commercial sexual exploitation of children. That's just to give you some ideas about the background. What we faced like several years ago, that all the time when somebody is paying for you to make the research, you actually do not have a lot of possibilities to study your own hypotheses and ideas. And after several years in doing the research between women, men, and children who were involved in the different types of the exploitation, we had our own ideas and thoughts and concerns, and we were curious, I can say, about many things which were not covered in the researching which we did for example, who were focused on the HIV/AIDS mostly, or health behavior, or condom use, or tuberculosis, or I don't know, like violence against women and so on. So that is why we came from the idea that actually this different approaches like deviant framework, public health framework, gender framework, commercial sexual exploitation of children, child rights perspective, trauma perspective actually didn't give us the idea about why and how the people find themselves in prostitution, how they are involved in the prostitution, what was the main reasons, do we have any differences between the people who are in prostitution or not. So that is why we actually decided to make our own research. So we find our own money, and we did it from the very beginning based on the academical and practical point of view. So we wanted to look for the reasons and the main factors which actually help the people to be involved in the prostitution. For our practical questions, we decided that we really want to know more about how they survive in the world of prostitution and how we can prevent their involvement, how we can effectively help them, and did they have any chance to went out of the prostitution, and why they return back. Now I want to give the word for my colleague Veronica, because we will make this presentation together, because we were in this field together for many years, but came from a little bit different approaches So she will be focused on this research which we'll present to you today.
Good afternoon, ladies and gentlemen, and I will tell you about the methodology of this research. So, many studies that have been done on prostitution before do not inform us about how individuals progress through the life course and through the prostitution. And on the slide, we have listed the theories and research that have helped us and that have inspired us to formulate a theoretical model of status in prostitution and to design our study. We wanted to get a detailed picture of what conditions result in girls and women engaging in prostitution, what happens to them at the time of being in prostitution, and how they come to the idea to leave prostitution, and what happens next. So developmental approach helps us to unfold what happens with individuals through time. To get the most complete picture of the pathways in prostitution, we tried to construct a sample saturated with various forms of prostitution. And additionally, we sampled women from 2 cities with great difference in the organization of sex business. In St. Petersburg, time location sample was used for selection of street-based prostitutes, and for venue-based prostitutes, Stellit relationships with managers at 6 brothels and 2 hotels facilitated recruitment. In Orenburg, all city venues and all 3 hotels in Orenburg were included in the study. Trained research staff from Stellit approached women directly at street sites and in indoor venues of sex business with support from managers in the hotels and brothels. All participants completed a structured face-to-face interview specifically developed for this study. A final sample size is almost 900 participants that was achieved across the 2 cities, and 70% of them were from the street venues of prostitution, and the rest were from the indoor prostitution venues. After the quantitative data collection was completed, we designed a small qualitative study for interpretation purposes. The study involved 15 adult women with different experience in prostitution, including those who exited prostitution. So, how we embedded developmental approach to the cross-sectional design of the study. On this slide, you can see the model that we have developed as a framework for analysis of the pathways in prostitution. We assumed that there may be identified 7 stages of the participation of women in prostitution: approach, entrance, adaptation, immersion, trap or professionalism, exit, and being an ex-prostitute. Entrance and exit are the single events, whereas the other stages are processes that may take some time. An individual may exit prostitution on any stage, but there may be reverse process when the woman returns to prostitution after her exit. The individual is included in various structures which affect her on each stage in prostitution, including families, reference groups, peers at microsystems level, community features, policing practices, criminal networks at exosystem level, policies, institutions, economic processes, and other factors operating on macrosystems level. And you can guess that stage of approach to prostitution is often happens in the childhood, before 18 years old. So in the interview, we asked participants a lot of questions about their childhood experience. On this slide, you can see the list of questions that we explored in the childhood part of the questionnaire. A bunch of questions on parental family features, norms, and behaviors. Peers, sexual activity before entrance into prostitution, childhood sexual victimization, runaway and addictive behaviors. Also, we asked questions about the circumstances of the first sex in exchange for money. And then we asked a bunch of questions on what happens with them in prostitution about their thoughts and attempts to exit from prostitution. In an interview, it was important to specify the age at which all the important events took place, as it allows us to build a time sequence. To analyze the data, we used a variety of statistical techniques. For example, we compared prostitutes' childhood experience with population-based data. We ran a lot of statistical and regression models, and we also published these results in many Russian journals, and also we have one paper in English language. And in this presentation, we will not show you any specific statistical model, but rather a general overview of what we see in our data. So I give the floor back to Maya, and thank you for your attention.
So what we got is the result. So how many actually came to the prostitution in the age under 18? What we had around 11% who reported that they were being under age 18 at that time. What is actually interesting that in many international studies, the people show very different results. I can say those who have more feminist approach, they usually show much more higher level of the minors who are involved in prostitution and who started like prostitution under the age of 18. I can say that in Russia probably it will be differences between the different regions. And what we also saw that, of course, not all minors, which we, for example, met during our outreach work, actually finishing in the adult prostitution. So some of them, of course, left this field, I can say completely. Of course, some of them, they just did not survive. But I can say that those who actually finally finishing in the adult prostitution, according to our studies in St. Petersburg and Orenburg, was 11%. It could be higher in some regions. It could be lower in others. So, but it looks that it's kind of like a average. So, what we have the experience, what is the childhood experience of women, like in our study? So first, tend to have a single parent family with the mother or full family with the stepfather. A lot of parents demonstrate much more lower social status and economical well-being. Of course, we can see that the relations in the family usually were much more harder and have much more conflicts than if you compare it with the population of women who started prostitution after 18. More frequent alcohol and drug abuse among parents and drug abuse among siblings. I can say that from other studies, what we also saw that the behavior of the siblings quite often have the critical role. Also, what was interesting, that more frequently the parents have the different relations and adulterer relations or different types of sexual relations other than the partner's sexual partner, like stepfather or the husband or wife. Acceptance of this behavior by the parents and also more frequent corporal punishment which they use and at home, and what we also saw, which is more typical, early drug use and alcohol use. What we also saw that a lot of them actually faced the labeling at school or from the different adults who labeled them as prostitute to be, as the possible way of their life. And most of them reporting the first commercial sex as the voluntary. So I can say what we also saw, that the difference in norms, which also in the attitudes towards the sex behavior generally speaking, because we ask a lot of questions about it. And just to give you some examples, what you can see it on the slide. For example, it was the question about unfaithful to each other as husband and wife. So you can see that it was much more higher. the next slide also show the same pattern, and the third one specify as a dominant attitude toward the sex for money among the friends, which was also much more higher. If we will come to some kind of the conclusion, what we find that what we can see, we have different pathways to selling sex. When we discussed it about the adults in prostitution, what was one of our main conclusions, that the women in prostitution are very different. So we can't speak about them as about one group of women which have the same problems, which demonstrate the same attitudes, who have the same norms and the same problems and outcomes, I can say. And when we look to this category of those who actually entering the prostitution as children and compare it with our own data, for example, and experience working with the children who were involved in the prostitution in St. Petersburg, we can say that, yes, they also will have a different groups of children. So they are not the same. And I think that for us it's critical because all the time we try to use only one, let's call it main theory. Like, yes, if we are focused on the trafficking, we will see the trafficking as the main way how they are involved in the commercial sexual exploitation. If we look to the, for example, violence and the sexual violence, we will find out that a lot of them were traumatized and so on. But if you look to the different factors, if you make it statistical analysis, if you just compare it with the qualitative interviews which we also made with the women and children in prostitution, we can say that yes, we will see the different groups of children, and they will come to the prostitution from the different situations. Let's put it like this. First of all, it will be these children at risk. And I can say that we work with this category of youth in St. Petersburg, and we can say that it's underestimated problem, because in any country we know exactly where are these kids. We know how to find the youth who are more at risk to be involved in prostitution, to be involved in drug selling, to be involved in different kinds of other criminal activities, to have problems at schools, and to have much more limits, I can say, in choosing the life strategy, I can say, in the life, which will be more, normal. So we exactly know that we have this group. So, and of course, we can say that in this group we see that normalization of the different practices. So for these kids, they have much more, they know much more, first of all, about the, life around them. They already have contacts with those who were involved in prostitution. They know people who use drugs. They start to experiment with the drugs much more earlier. So they know who and how much does it cost, for example. They know people who can be a provider, for the world of the prostitution. So they have much more information, and they know how to deal with this. So, and I can say that for a lot of them, they actually think about that. Is it okay for me? Is it not? And when we just if I will give you an example that we just finished the research between children in the child institutions, where we ask them about their future, how they see their future, which scenarios they see. And I can say that some of them, they really think about selling sex as the possible way to get money. Not maybe for the whole life, but in many situations they are ready to do this, and they know how to do this, and they know the prices, and they know who can help them with this. We have another group of children, and I can say that, of course, it will be a small group of children, but this is children who were involved through the violence. It happened So they had no ideas about what will go after that. They were involved through trafficking, they were kidnapped, they were raped, they were sold after that. So, but it's much more like smaller group if you compare it with the first one. And of course it will be repeated sexual abuse in the childhood. It will be like forced involvement in the selling sex. And they will be much more under the control of the adults. So the third group of children, this is the group of children which is not, I can say, that, for example, our authorities are afraid even to talk about this group of children. And I can say that if we will come from the perspective of the child rights approach, and even from the approach which ECPAT has, that we will find that we are not ready to have a group of children who are voluntarily selling sex or exchange sex for different types of goods or money or services or drugs or whatever. So, but they're looking like we can call it also like surviving sex, but quite often this is one of the most difficult group, for example, for rehabilitation. This is the group which is the hardest, I can say, for different child institutions, because they're not like real victims, how a lot of social workers like call them, yes, because they know what are they doing, they feel quite well in it, and quite often they do not have anybody who control them or who force them and who have money from them, so who really exploit them. And also we have a quite big group, I can say, especially in the big cities. These kids who the most driven factor for them, of course, is the drug addiction. And for them, this is the only one way how they can have money to buy drugs. And of course, this is they're usually much better controlled by the, for example, representatives of the organized crime group or by the different kinds of perpetrators or even peers who use this addiction. But in many ways, we are talking about like 4 different groups of children. And if we are talking about this 4 different groups of children, I can say that if we will look for example, for the population of women, for example, of those who were involved in the prostitution in the age under 18, I can say that they will have a different life in prostitution. So, for example, those who entering prostitution as the minors, like, were more likely than those entering as the adults. Like, so we can see that they will be less educated, that they will be less involved in the opiate use, at least in St. Petersburg it happened, involved in the prostitution organized by the others, worked in the indoor prostitution, and they had much more contacted with the criminals. They were less aware of the fact that prostitution is actually violence of the administrative code, and they were more often agreed, like we gave them the different statement about the prostitution, that for women prostitution is a natural way of the earning good money. So what is important for us, that if we are talking about the different groups of children and women, we need different programs in prevention, in rehabilitation, in social control, generally speaking, and in the policy, if we are talking about like commercial sexual exploitation of children or adults in prostitution. Of course, our research had a lot of like limitations, and of course we need to tell about it, that generally speaking, of course, it's very hard to find the big number of children who are involved in the prostitution. So so we will never speak about like a good enough sample size. Of course, it will be the much more high criminal control, at least now, for example, in Russia, where it's very hard to find a child in prostitution and openly like who openly like selling sex, for example, which we had at least like 7 years ago. We had a couple of places where you can go and just like find them. We have a very low level of identification of child victims of different types of sexual exploitation in the different crisis institutions and crisis centers and so on. And they actually does not exist as the category of beneficiaries in the state children's crisis centers or hospitals. I can say that childhood experience is possible to research only through involvement of adult prostitutes. This is I can't say that it's more easy, but at least it's possible. Of course, we have some limitation of the retrospective data which we use. Of course, we can't say about the whole Russia, so here we can speak only about those cities where we made the research. But in any ways, I think that it was a very interesting possibility for us to look to the group of women and group of children. Some conclusions. I can say that, as we told, that if we need the different types of the prevention programs, I can say that now we do not have anyone which we can call like not even evidence-based, but we just don't have even a normal or working prevention programs for youth at risk about being involved in the different types of the sexual exploitation. Another thing is that because we never actually pay attention to the social norms of sexual behavior of children and young people from the risk group, so we do not know a lot about it. And we definitely need more studies which will be focused on these issues. But to be honest with you, I don't think that it's really easy to do this in the modern Russia, which is really don't want to do any kinds of the researching which will show our country in the bad way. What is interesting that working with the different groups of professionals in Russia and in other CIS countries, what we see that a lot of professionals, they actually think that we can't help them. And those children who are involved in the different types of sexual exploitation are lost for us. And also they think that it was expected that it will happen with them. So a lot of professionals, they really believe that some group of children who has some problems surviving in our social system do not have chance actually to skip the prostitution, because for them it's the best option. I can say that the most of the studies are concentrated on the outcomes of the prostitution or commercial sexual exploitation of children, but not on the involvement and on this stage of being in the world of prostitution, being in this life. So we usually came from the perspective that we will took away the child immediately after we will identify the child, but we have these groups of children who actually don't want to escape. And in this case, we will have a conflict of interest, I can say, of the different kinds of social services and institutions who try to help them, and those children who don't want to escape. So in this case, like, we really need to think more about what is their life and what are the even positive sides of their life, how they see themselves, and so on. It's the same like with the adults. I can say that norms and circumstances of their life and selling sex are very poorly studied and are not considered in the rehabilitation of these children. And I can say that maybe it's one of the reasons why we have so, I can say, bad results in the rehabilitation of the victims of the commercial sexual exploitation between children, and so a lot of problems with the identification process. So I will stop right now because I think that we want to have more time to the questions and the discussions. Thank you very much for your attention, and for us it's a great pleasure to be with LINEA and to participate in this workshop.
Great. Thank you very much, MAIA and Veronica. So we have about 15 minutes for questions and discussion.
So we see one question, like, do you think that our findings are similar across other countries in Eastern Europe? Which countries? It's a good question because we try to compare it. We try to compare our data with the data from Kazakhstan. I can say that it will be some differences. I can say even in Russia it will be different findings in the different regions. For example, in St. Petersburg we have big numbers of women in the street prostitution who have the very hard addiction to heroin. And in Orenburg it will be a very small group of women like who will have the drug addiction. So we want to compare the data with other Eastern countries. We spoke with the colleagues in Georgia, and it was quite interesting. So some things are quite similar. We also spoke with the women, with our colleagues in Poland and in Ukraine. I can say that we will have quite a lot of similarities with Ukraine, much more than with many other, I can say, Eastern countries. We also have a big group of Russian-speaking women, for example, now in Czech Republic and in some other like Eastern European countries, who actually change the whole picture of the prostitution in some Eastern countries. So it's so we didn't have a concrete goal to compare it, but it will be extremely interesting. But I can say that, of course, this data will, as we told, have some limitations.
Okay. Thank you. Another question has come in from Patty. Thanks for the excellent presentation. Can you please talk a bit more about how you were able to recruit underage prostitutes for the study and how you conducted the interview?
For this particular study, we will not concentrate on the underage. So we were actually concentrate on all women who were available. And because, of course, we didn't check their passports, so of course we had also women who were underage. So that is why we didn't have any problems with the recruitment, because at that moment when we conduct the study, we had our own outreach program. So we really know where to find them. We really know how to talk with them. We had very good relations with the women themselves. So they really spent a lot of time with us, answering all our stupid and and big questionnaire. So, but of course, it was not a problem. If we are talking about the kids, as I told you in the presentation, we also had an outreach program for children actually. So at that moment, it was easy to find at least like some kids who want to talk with the researchers. Also because we trained different social workers and psychologists in all 8 crisis centers in St. Petersburg, we had access to the children who were at that moment in the different types of crisis centers. But as I told from the beginning, we were not focused on the underage prostitution. We were focused on prostitution generally speaking. And I can say that, of course, now we know much more about it than we know before we did this study, that somehow they are connected. So commercial sexual exploitation of children is not isolated from the adult prostitution. So some part of children actually will be available to these adults in prostitution also. But of course, we will have different types of children, especially children before age 13. And that's completely different animals. So that need completely different ways to recruit this kind of children. And I can say that it's very hard to do a real interview with these children. Like, for example, my experience when I came first time in my life, when I first time actually saw the children in prostitution, I came to the Brussels where I found children and the oldest was 12 years old. So I can say that all my ideas about the interviews were destroyed completely because you can't make the interview with the child who's actually in sexual exploitation. So it's not ethical. So that is why it's a different types of the researching. So we can talk about survivors, we can talk about some kind of data which we can collect through the professional, but we can't conduct the interview with the real child under the age of, like, let's say, like 14, maybe 15, as we do with the adults. So this interviews will be completely different.
Thank you. I'll just add one thing to that. One of the webinars that we plan to have early next year will be on ethics around conducting research with children on sexual exploitation. Not sure yet which ages it will focus on, but that will be one of our early webinars next year. I think that's probably relevant to a lot of folks doing this, hopefully. Maybe while you're thinking, I could ask one question that I had. I thought it was really interesting when the presenters were talking about the different theories that have informed this type of research, and it sounded like you were saying sometimes your outcomes will even vary depending on what approach is taken. And I was wondering, from your experience, if you have sort of recommendations or thoughts on integrating these different theories that are out there, and how you would recommend sort of undertaking a research study, either combining those perspectives or what your approach would be.
I can say that our idea was that we took the most of the famous theories, which are, at least in sociology, describe the entering to the prostitution. And we just try to look, does they work or not? So we look to the theory of, like, violence, like in the childhood. We studied it. We had several questions which were studied this concrete idea. We also look at the economical choice, like free economical choice of women as the profession. We also look even to the biological theories. So we ask about, do they have a more sexual, they want to have like more sex, and to have money, like this, we had this theory even in 19th century, but I think they're still popular. And we actually find these women, but it was, of course, like a few people who actually reported it. We also look to the labeling and to the stigmatization during the childhood and the youth period of time, like when they were very young. We also look for trafficking. So we try to identify those who were like involved in prostitution through trafficking. What was interesting that, for example, if we are talking about the adult prostitution, what we find out that it was a group of women who has absolutely no one serious reason to be in prostitution. Like if we are talking about the theories. So they were not victims of violence. It was not an economical choice. It was no labeling. They grown up in the good families, and it was interesting. And we couldn't find any explanation why actually it happened with them. So what was interesting, like when once I was on the flight to New York, it was a long flight, and I had a back pain. So that is why I couldn't sit. So during the whole flight, I talked with the stewards in the plane. And it was interesting because for me, I'm afraid to flight. So for me, it was a question, why actually they choose this profession? And it was interesting because when they start to answer, what I find out that they actually answer exactly in the same way like this group of women who had no reason to become a prostitute. So it was kind of like by accident. It happened by accident. So they just met a person and like they had no clear ideas what to do, and they said like, oh, it will be nice to be a steward on the airplane. And finally, they said, like, oh, no, we don't like this. Like, really, it had a lot of minuses, but it has some pluses. So they were adopted to this profession. For example, so it was also kind of like a theoretical explanation, which came mostly in management, like how the people actually choose the profession and their life and the education and so on and so on. So it's quite interesting. So, but I think that when we have any kind of theories which we strongly believe in, like for example, I believe that this is exploitation, and I will use all my experience to prove it. And after that, yes, of course, I will find out that 90% of women, they were hardly exploited, and I will try to find like how it happened and all these reasons and so on. But from my point of view, by the way, I strongly believe that this is exploitation. But in any way, the women are very different, and their way to prostitution is very different. So we need to what can help us that if we will not be biased, like when we plan the research, if we will not try to prove what we are believing, that's our lesson learned.
We have time for one more question, and there's a question from Katherine, which I'll just read out. It says, thank you for a very interesting presentation. In your interviews, did you get an idea of who is buying sex from minors and other vulnerable groups? Do you think there's a scope to work with those who are buying sex as part of prevention work?
Oh, great question, Katherine. But, I was on the very interesting meeting in Geneva about the demand and about, actually who are these people who are buying sex from minors. And we had a big discussion, because I think that we know our knowledge is very limited about this issue, unfortunately. Because what we know about the perpetrators, it's mostly people who were arrested or the people who were already identified. So we know more about them. I can say that the representatives from the criminal police, actually, they can tell a lot about it. But what we also know from our experience when we made the research about it, like in Russia, what we find out that we find a group of people for whom it was absolutely doesn't matter from whom they buy sex. It depends on the sex. The man whom I interviewed really shocked me when he told that for me, if we are talking about the oral sex, it completely doesn't matter who do it. Is it a boy or it's a girl or it's a woman? I just want it now. It's cheap. I can buy it. That's it. 5 minutes. I'm free and I don't care who did it. So he was not particularly looking for the child. He was looking for the cheap service, and it was very open-minded, at least for me. And I can say that if we are talking about prevention, I'm not a big specialist on the demand, but I think that what can really help if we can have effective prevention programs for the youth at risk, because they really need a lot of help from us. They can't survive in our great societies with our great social systems and system of education without the help. So, and that is why for them sometimes it's much more easier to end it up in the different types of criminal activities or prostitution than to really squeeze into our normal society. So, and if we will not have the good evidence-based programs which can help the people, the young people in need, we will never successful. That's my thoughts about it.
Thank you very much. I think we'll go ahead and wrap up now. So thanks again to everyone, and we'll look forward to seeing you for the next webinar.